Hey everyone, so just a short little lecture here about breast assessment. Generally, in your practice, you won't really be responsible for breast assessments on your patients, but having just some basic general knowledge is a good practice to follow. After you complete this lecture, there is a case study that's also posted in Blackboard. And then there's also several files that you can use as references to help you through that case study. And then there's a Dropbox in the same content folder, so that's where you can turn your answers in. So to start with, let's look at the anatomy of the breast. The breast tissue lies above the pectoralis major and serratus anterior muscles. Generally, the tissue is located between the second and the sixth ribs, extending from the side of the sternum to the mid-axillary line. The superior lateral corner of breast tissue in women is called the axillary tail of Spence, and this is the tissue that projects up and laterally into the axilla. The nipple is just below the center of the breast. And here's the picture depicting all of that. So the internal breast tissue is composed mainly of glandular tissue, fibrous tissue, and adipose tissue. And again, another image identifying the different types of tissue. You can see in the picture to the right where it shows how the breast tissue lies associated to the ribs. So when you're doing your breast exam and when you're teaching your patients about breast exam, you should divide the breast into 4 quadrants with an imaginary horizontal and vertical line that intersect at the nipple. This makes a convenient map to describe findings. So you could say like upper outer quadrant, lower outer quadrant. The upper outer quadrant includes the axillary tail of Spence. It's important to fully examine this area because it is the area which most commonly involves tumors of the breast. So here's an image of what those imaginary lines would look like, and you can see where your upper outer quadrant extends all the way up into the axillary tail of Spence. The breast tissue has extensive lymphatic drainage. There's 4 groups of axillary nodes: the central axillary nodes, the pectoral or anterior axillary nodes, the subscapular or posterior axillary nodes, and the lateral. Male breast tissue typically consists of a small thin disc of undeveloped tissue which lies underneath the nipple. It is normal for adolescent boys as they go through puberty to develop a condition called gynecomastia, which is just a slight enlargement of that breast tissue. It's usually one-sided, usually temporary, so it's important to reassure those adolescent males, if you have them as patients, that this is a normal finding. It can be embarrassing for them, affecting their body image, but reassure them that it does resolve on its own over time. In the contrast of that, if you have gynecomastia that reappears in an aging male, that can actually be related to a deficiency in testosterone. The incidence of breast cancer varies among different cultures. Women who inherit the BRCA1 and BRCA2 genes are at increased risk for developing breast and/or ovarian cancer. There are different risks for breast cancer related to age and ethnicity. The Women's Health Initiative study looked at increased linkage with use of combined hormone replacement therapy or use of estrogen therapy during menopause and the development of breast cancer. It's important to educate patients to begin screening mammograms starting at age 40. For women who have a high history of breast cancer in their family, it's important for them to actually start their screening mammograms 5 years after the age of first diagnosis. So for instance, if you have a client whose mom was, 5 years before the age of first diagnosis. So if you have a client whose mom was diagnosed with breast cancer at age 35, then you would want to have your client actually start her screening mammograms at age 30. There are certain lifestyle risk factors that also will increase risk. Alcohol has a dose dependent effect, and what that means is the risk increases with the amount of alcohol consumed. So, for instance, if you have a client who drinks 3 drinks per day, her lifestyle related risk is going to be greater than your client who maybe just drinks on social occasions. It's important to educate patients to continue physical exercise during aging, as this does help to slightly reduce the risk. Postmenopausal weight gain, so weight gain that women weight gain that occurs after they go through menopause, negates the effect of physical exercise. So what that means is if you have a woman who becomes more obese after she goes through menopause, but she has exercised her whole life, those two things kind of balance each other out. So it's important to help to control that weight gain after menopause so that you're not negating the effects of the physical exercise that you're continuing. Some other factors that contribute to breast health are low income, lack of health insurance, your geographic region, culture and language barriers, and racial bias. And these are just because the clients might not have access to the same screening that other clients would, and maybe just don't have the general knowledge. Also, if they don't have healthcare insurance, they don't have the finances to be able to pay for the screening. Important subjective data to gather from your patients: any pain, lumps, discharge, rash, swelling, trauma to the breast, personal history or family history of breast disease, any breast surgeries. What are your self-care behaviors? For instance, do you perform a monthly self-breast exam? Do you get your mammograms on an annual basis? Also, any tenderness, lumps, or swelling in the axillary region, and any rashes. So we all know that in our culture, breasts are very sexualized. So finding a breast lump, the diagnosis of breast cancer, the potential of breast cancer can be very troubling to many women. It can cause a lot of anxiety, some fear, some panic. So, although most breast lumps are benign, women will initially assume the worst possible outcome. So, when you are collecting your subjective data, make sure you kind of tune in to cues to what your client is saying and those behaviors, and try to provide some reassurance. You definitely don't want to tell them that, you're sure there's nothing wrong, but at least to provide them some reassurance and tell them that, most lumps are benign. We do encourage further testing, but just to try to provide them some reassurance, but also give them an opportunity to voice their fears and to talk about the thoughts that they're having. Breast cancer is the second major cause of death from all cancers in women. Early detection and improved treatment have increased survival rates. So that's really good news for us. The 5-year survival rate has actually gone up from 78% in the 1940s to 98% today. So pretty amazing things that are happening in the field of oncology when it comes to breast cancer research and treatment. If the cancer metastasizes, the survival rate is 84%. So still a pretty decent survival rate, but obviously lower than if we just can control it when it's localized to the breast. So teaching self-breast exam. It's important to help women to learn how to develop a routine. So some of the points that you want to provide when you're giving your education: the best time to conduct your breast exam is right after your menstrual period. So the breast tissue is less swollen, the breasts are smaller, less tender. Pregnant women and menopausal women should still do their monthly breast exams. It's better to tell them like maybe the first week of the month or the last week of the month, just to like identify a time, since they don't have a menstrual cycle to follow to do their exams. It's important to stress to women that doing a self-breast exam familiarizes them with their breast tissue and the normal variation. So when I was in practice, I would always tell my patients, it's one thing to go and have a mammogram done every year or to get a breast exam during your annual exam. But if you are personally feeling your breast tissue and doing your exam every month, you're the one who's going to get to know what your normals are, and you're the one who's going to pick up on if something is different than it's ever been before. So it's very important for them to do it. In the most common complaint you're going to hear from patients is, well, I don't know what I'm feeling for. And the reassurance that I would provide to them is that if you're doing your exam every month, you're going to notice if something is different. And then definitely encourage them to report any unusual finding. They would, come into the office, get a breast exam done by provider, nurse practitioner, nurse midwife, physician, whoever, and then generally they would get scheduled for a mammogram or a breast ultrasound to investigate the problem further. Some important things to discuss with your patients when it comes to self-breast exam. The majority of women will never get breast cancer, so it's still important to do your breast exams every month, but reassure them that the majority of women do not get breast cancer. And the majority of women, if they find a concern, it ends up being benign. Early detection of breast cancer is important. So that's why we want women doing self-breast exams, and that's why we want women having this screening done. If breast cancer is caught early, survival rate is 98%. Also, keep your teaching simple. So the simpler the teaching, the more likely the patient is to follow through with it. Describe the correct technique, which is, the same thing we talked about before, dividing the breast into 4 equal quadrants and palpating all of that tissue in all 4 quadrants. Generally, you want to have the patient use the pads of the first 2 or 3 fingers on whichever hand. You would use right hand for the left breast and left hand for the right breast, and just go in a circular motion. Make sure that they're feeling all of the tissue. They can do it in the shower. They can do it in front of a mirror. They can do it laying down in bed. Whatever is comfortable for them, as long as they can get themselves into a routine and they're doing that same routine every month. In the lab, there are breast models that I know Mary Lou and Heather will get out for you guys. I do encourage you to feel the different models, feel the lumps, and a lot of times they have those in offices too, so that if a patient really is like, I really want to know what it feels like, and I really want to know if I'm feeling something, so those models can be very helpful so that patients can simulate what they might find on an exam. So now that you've finished this, take some time, go through the breast cancer case study. Like I said, I also posted a few resources for you to use. I just want you to cite resources. So if you use a website, if you use your book, just at the end of your case study after you do your answers, just make a citation for where your answers came from. As long as you have data to support what you're saying, then that's all I need. If you're just making stuff up, then you potentially could lose points. So feel free to email me if you have questions. The case study is due, I think, by the end of the week next week, I think is what I have it set for. So anyways, it should be available to you to turn in whenever you're ready.